Welcome back. Mr. Patrick Crawford, family and child clinician and licensed clinical social worker, has joined us. Patrick, welcome to the show.
Thank you very much.
So going back to the call for a moment, tell us about the normal, or not normal, but what the process of development is for kids and how kids may be affected, or their development may be affected by domestic violence.
Okay, so traditionally,
yes,
one of the things that we typically like to look at when we see children, we want to make sure that they are biologically, psychologically, and socially well developed. So tendencies are from birth to child, they have a lot of nurturing, and then as they get older, they start to receive the impacts of development from their environment, which shapes their naturing, such as, teaching them how to do cognitive things, tie their shoes, how to walk, how to talk, and then as they get older, they tend to move towards a development of looking for external stimuli to teach them a process of learning. The challenge is that when that happens with domestic violence, they also are external stimuli for that child that they learn from. And so each and every time they experience or they hear it, it becomes a learning part of their process. They can't actually distinguish, depending on the age of the child, whether or not that information is right or wrong. They just see it. So their processing continues to evolve, grow, and develop. A lot of times when that tends to happen, we tend to see that in when children are struggling in school, where they tend to become a little bit more physically aggressive or verbally aggressive when they're interacting with other children. And so that may be like a warning sign that, hey, there may be some things that are going on that possibly could be explored. Throughout that process, what ultimately ends up happening is you see children that are not necessarily engaged, or an intervention has been brought to their attention. And then you see children as they become latency age or pre-adolescence, you start to see them matriculate more towards that physical or verbal aggression. And ultimately they tend to look at not necessarily the distinction between gender, but just the fact that this is a part of who they are socialized to be.
And so you talked a lot about some of the obvious things we can see, the aggressive nature and things like that. How about some of the psychological things that maybe people can't see, a kid that may internalize it and may not act it out in a way that we can see?
Yeah, and that's quite interesting, because a lot of times with younger children, when you start to look at them, most of the time they're externalizers with their behavior. Most children that like to be interactive. But then you'll start to see children that were interactive or are starting to be engaging, they tend to start to take a step back. They tend to start to isolate a little bit more. They tend to start to not want to be around people, or they tend to not have the same interests. And so a lot of times that earlier in their development that it is impacted, the more they start to change how they engage other individuals. So it's important for us to really do a better job of understanding how do we get children to become more externalizers in their process. Because when they start to internalize, there's some things and stuff that we may never pick up as professionals, but even parents, because if parents are dealing with a domestic violence situation, their concern more than likely is their safety or the child's safety, but they may not pay as much attention to their emotional or social development and well-being.
And so is there a point where kids might regress, like maybe a child had started to make, like they were fully potty trained or something like that?
Yes.
Talk a little bit about that.
So a lot of times when children start to internalize fear, we typically label that as anxiety, especially in younger children, and they start to become potty trained, they start to progress developmentally where they're supposed to, where we're trying to train them to be. But when they start to hit these traumatic experiences in life, what tends to happen is it starts to unravel as far as their ability to process information, and things that they were taught don't seem to make as much sense because the inconsistency is there. When you add in verbal or physical abuse to someone that is supposed to be training them, which is typically a parent or someone that is an authority figure, they tend to have some confusion with how that actually looks with regard to their process, because they'll say, well, this is what I'm supposed to do and this is what I'm going to do, and then all of a sudden it will be a little bit different because those things that have impacted them greatly, they don't know how to express them. They don't know if they can talk, and depending upon the situation at home, it may be a situation where whatever goes on in this house stays in this house. It could be a situation where we don't talk about things that go on at home because these are things that are internal, these are things that we'll handle as a family. And so that also starts to weigh on the child as well, because they don't really have an outlet. They don't have anyone to talk to. They can't go against their parents or whoever their authority figure is, because if they do, then what's going to happen to them? They don't want to breach the trust or the relationship they've established with their parent or their guardian. So they tend to start to, instead of saying anything, they tend to just say that, keep it to themselves. And that's really, really difficult for younger children, because once again, the impact of it is, how is it not only impacting them, but what does it lay for them as the foundation for them as they move forward in life? It makes it very challenging.
Tell us, Patrick, now I know you work with the Family Crisis Center, but you have your own practice as well. Can you share with us some of the things you've seen in your practice?
Yes, I can share some of the situations that have occurred. We tend to get a lot of referrals from a lot of different agencies and resources, and one of the things that tends to occur, especially in those domestic violence situations, they're not actually seen for being victims of domestic violence. They're usually seen because their behavior has been inappropriate and, as early as 5, 6 years old in school, but then they start to change at home. Parents may start to notice that, well, they used to like to go outside and play, but now all they do is stay in their room. Or they used to have really a lot of friends, but now they don't have any friends anymore. So when we get children that are referred to us, it's typically not related to domestic violence until after we get an understanding of what's actually going on in the house. And a lot of times the children, when they're doing some type of play therapy, or if they're using something as an expressive modality that we're using to engage them, that's when it kind of comes out, because we have to establish a relationship with them. We have to trust them. They have to trust us, excuse me, and we're trying to build that. But ultimately, it's not something that they immediately share with us. It's something that by chance comes out, because as practitioners, we only go on what's reported, and then as we start to establish the relationship, we get a better understanding. But to answer your question specifically, we see a lot of the challenges of behavior, which will stem from not listening to the authority figures in the home or outside of the home. We tend to see a lot of isolation. We tend to see a lot of children that have aggressive play. And you see that when they're demonstrating that with the toys they may pick up. They may do that if we're doing an art exercise. They may do it with the colors they choose as relates to the expressions of what's going on inside. So a lot of times we will see these things, and as clinicians we have to be very skilled in recognizing what do these things mean and getting the children to open up and share those things. But also the parents are a very important part of it, because they have to be able to express when the changes occurred, and we ask questions to the parents because they're a little bit more verbal to help us out. So that's the array of things you can see. It could be as slight as, or as minimal as just them not wanting to engage at all, or it could be when they go in and they first toy they grab as a doll, and the doll is being grabbed and thrown around or being choked or being hit, and that's the nature of their displaying the symptomologies that they come with from their environment.
One more question for you as we look at the problem of the impact of domestic violence on children. Why is it that often kids will draw near or treat the abuser kind but mistreat the victim, the parent who's the victim?
Well, children tend to like consistency and normalcy. And sometimes one of the phrases that I case is that there's a normalized dysfunction that we exist in. And that normalized dysfunction for children is evident because once things start to change for them, they want to look and see, well, why is it that's changing? Why is the situation changing? Why is the environment changing? And sometimes they may see the person that is maybe reporting or the person that is pulling away and forcing them to make a choice at such an early age is the person they tend to become upset with, not realizing that the situations they've witnessed are very detrimental to the victim, but they really just want normalcy, and they tend to say, well, this is normal. You're the one that's trying to remove or trying to establish an inconsistent relationship or this inconsistent family structure. Mm-hmm. So a lot of times when children do that, they may gravitate to the abuser because they're the one that's there. A lot of that also may have to deal with what the abuser may be sharing with the child when they have the opportunity. They may be saying things such as, you know, such and such doesn't want you to be here, and I don't know why. You know I love you, and you know that we have a great time with each other, and this is all. So it could be a number of reasons why they gravitate to them, but those are two of the ones that I think in working with children that I've seen the greatest deal is their environment changes suddenly, and because of the abuser sharing their thoughts and perspective of what's going on, then that may be the thing that sways the children as well.
Great contribution. We'll be back with more Chats for Change right after this.
I want to eat apples and bananas. I need to eat apples and bananas. Why can't I eat?
1 in 5 children struggles with hunger in America. Support the Feeding America nationwide network of food banks to help provide meals to those in need. Join us at feedingamerica.org.
Welcome back. We are talking about the impact of domestic violence on children.
Yes, and so thank you, Patrick, for sharing all that you shared prior to the break. Talk to us now about solutions. How can we help children that are exposed to domestic violence?
Wow, that's a very broad. Do we have enough time to talk about all this? I think it first starts with the ability to recognize that it does impact children. A lot of times as adults, we tend to not recognize what the children are going through because we're going through so much. So a lot of times that recognition prevents us from being able to provide for our children when they're in need. One of the things that I think about is that we think about the physical safety because that's the main or the primary concern is what's going to happen physically, because that's what introduces our children and even the victim to governmental assistance or those inquiries by the government to find out what's going on. I think that one of the things I would love to be able to do is to be able to expand the partnerships that we have with, such as your agency, to be able to, once we recognize that it has occurred, to be able to go in and do assessments with children. Just like they do the lethality assessment for the adults, being able to construct something that allows for us to work with children, even if it's briefly. Because the one thing as practitioners we don't want to do is we don't want to disrupt the appropriate adjustment that children go through when they engage in a situation such as domestic violence or they've witnessed a domestic violence situation. But we do need to explore what exactly have they retained, what is it, how does that impact the process of their thinking and how they are engaging in psychological, social, emotional relationships. I think that's what I'd recommend first and foremost is if you've ever been in a situation and they're children, definitely try to bring them in to see some practitioner or a mental health counselor so that at least you can get an assessment done.
And so absent of that, because we know it's, I mean, I totally understand, but looking at the other side of that and the challenges that so many people have with getting to that point, right? To where we actually walk through the door and get help. Not even for ourselves sometimes.
Absolutely.
So if there are people watching right now and maybe you're a grandmother of or a teacher of a child that's been exposed, what maybe is something that they can start to do as a lay person just to reassure that child or whatever the case is?
So a lot of times, and we use this in a clinical terminology, we call it social emotional corrective responses. A lot of times when children are experiencing inappropriate or things that are out of their understanding or beyond their understanding, it tends to stay with them, and that's really where the trauma actually starts to linger because they can't actually grasp and they can't actually decipher what's going on. But as a person that may have knowledge or may have possibly suspect that there's something going on, one of the things that I would always recommend is to just spend time with the child, an appropriate amount of time with the child, obviously, just to make sure that they feel comfortable enough coming to you, reassuring them that there are people that they can talk to, even within the home. If it's a grandmother, an aunt, if there's an uncle, if there's a grandfather, if there's a school counselor, if there's a teacher. Those are the things that I think that we have to encourage our children. And as parents, we have to encourage our children to at least let them know that even if you can't talk to us, there's someone out there that you can talk to. But I think it starts with that trusting relationship that children spend so much time developing, and then to make sure that they have an understanding of what things are appropriate and inappropriate when it comes to situations, and maybe even having the ability to write things out. Maybe because they don't want to talk or they may be limited verbally, but maybe they can just share because this is what they saw, draw a picture. They can do just minute things to share what's going on, and as adults we can do a better job of actually listening to our children and seeing what's going on, engaging them in healthy relationships.
And so that might be challenging for that parent who doesn't even know what that looks like as an adult, right? Can you talk about the importance of engaging a family as a system, even if they're in an unhealthy place?
Yes, I think that one of the things that, as I said earlier, we normalize our own dysfunction because we exist in it. And as long as we make it through that day or that week or that month, we think it's okay. So I think that part of it is being able to recognize that, and I know it's something saying recognize, but I guess it's kind of difficult. It's also about a feeling. I think that you really have to understand, what do you feel in that situation as an adult? Does this feel right? If it doesn't feel right, then maybe that's an opportunity for you to explore it. Even if you don't want to bring your children into it at that time, maybe there are things that you can seek out, because each person has an individual situation that they're dealing with, and it's kind of hard for me to lay a blanket statement on this is what you should do. But if you are an adult and you don't feel that things are occurring or things are going on, always reach out to someone that may be able to provide you with more information in order for you to get an understanding and to see. But I'll still go back to the relationship, which is so important. If you can establish a trusting relationship and getting that child to feel comfortable with you, which I think that a lot of adults can establish good, healthy relationships, then that's the gateway to exploring and getting them to talk about it. And then from there, then you can actually see where you go from with that information.
And so if people want you to be their gateway, tell us how people can get in touch with Patrick Crawford.
Okay, so they can always reach us at our website, which is www.crawfordconsulting.org. That's CrawfordConsulting.org. Or they can call our office, which is 301-341-5111.
Excellent. Excellent.
Wonderful. And as we wrap up the solution set and a great conversation, can you give the folks at home just some brief advice? If they're a little nervous about speaking out or getting help, the families, the parents, what would you tell them?
I would say that let me start off by saying this. I do understand how difficult it is to reveal things that are going on. And I think that a lot of times when it comes to us revealing, we always look at the negative things that can occur in these situations. But the reality is, at the end of the day, our children are the future, and we have to be able to make sure that we provide for them every opportunity for success that we didn't have.
Yes.
And so when you ever have that question about whether or not this is the right or appropriate thing to do, you want to be able to make sure that you err on the side of caution than on the side of this is what's going on and I never did anything about it. Because at the end of the day, you still have to live with yourself, and that child has to live with the things that are occurring as well.
Thank you so much, Patrick. Thank you for being here. Sophie, thank you for your expert opinion. The Family Crisis Center, of course, has programs dealing with the issue we discussed today. For more information, visit fccpg.org. If you or someone you know needs help, dial 211. We are here and we will help you. Thank you for watching Chats for Change. We will see you next time.